I am going to tell you about the collection of blood. There are two ways of obtaining the sample. First is from vein and second is from capillary. Firstly, I want to tell you about the venous blood, how we collect the venous blood. So, for collection of venous blood, we firstly tell our patient to sit properly, make them in laser position, make them comfortable with the chair, with the bed, with anything where he is sitting or sleeping. After that, tell the patient to straight their hand. Okay. After that, tie the tourniquet above the elbow. It should not be on the elbow, it should above the elbow, and there must be a gap of 2.5 centimeter. Okay. After that, we after tying the tourniquet, we clean the area of the antecubital vein. Actually, firstly, I want to tell you about the antecubital vein. The antecubital vein is the vein which is on the elbow and from where we take the sample. Actually, we take this vein because this vein is very prominent. We can see it very easily. We can find it very easily. And second, there is a good flow of blood as well. Okay, this is proper. It has a proper thickness. Okay, yeah, that's why we took this one. And it's the side of the antecubital vein, there are two veins as well, bicephalic and dicephalic. We can take blood from there as well, but firstly we prefer the antecubital vein, and that antecubital vein is we can find at the antecubital fossa. Right. After tying the tourniquet, come on the process. After tying the tourniquet, we clean the collection area, like from where we are going to collect the sample. Firstly, we take a cotton ball in which we can take any rectified spirit, or we can take iodine solution. When we take the iodine solution, after that put it at the center of the elbow and clean it from center to peripheral. Okay. Why we clean like this? Because by this there is no chance for having the any infection, any bacterial infection, and it will clear clearly. Okay, it will clean clearly. Okay. After that, after cleaning, we tell firstly we puncture the antecubital vein. We take the vacutainer. You can take the syringe as well, and you can take some vacutainer as well. Firstly, take vacutainer, put the needle in it. After that, go to your area and puncture the vein. After that, take an anticubital and I am telling anticubital anticoagulant vial. Okay. There are some anticubital vial, sorry, anticoagulants vial are there. Like there are some vials which name of that vials are like citrate vial is there, fluoride, heparin, trisodium citrate, EDTA vial is there, red vial which is plain vial, yellow vial which is also a plain vial. Okay, so these vials you can take, and you can take sample from by the help of vacutainer. After that, um, then take the sample in vial, and just remember one thing: in vial there must be sample or blood in one third amount. Don't fill fully. Okay. And don't fill half, just it must be one third. Okay. Because there are some anticoagulants which maybe work in a proper amount of blood. Okay. Yeah. After that collection of sample, take out the syringe. Actually, there is a draw order as well, that how we can collect the sample in exact vial. Like first of all, we should take blood in a blood culture. After that, we can take blood in citrate vial. After that, we can take blood in another vial like EDTA vial. Yeah. After that, you can take blood in red vial, yellow vial. After that, go with heparin, then gray vial. Okay. This is the order of draw, that how we should draw the blood from the vein. After that, after collection of blood, you take the sample and put the sample in rack. Now come at to patient again and remove your, firstly tell the patient to open their fist and remove the tourniquet, then remove the what is this? Okay. Then remove your vacutainer. Then put a cotton ball at the punctured area and make firm pressure on it so that the blood flow can stop and there must not be bleeding. It must not be bleeding. So this is the whole process of collection of blood from the vein. Now I want to tell you about the use of this venous blood. So from this venous blood you can do many more tests, like there is CBC, liver function test, kidney function. You can't do testing from the capillary blood of these big tests, okay, because it requires much sample, it requires serum, it requires red blood cell in much quantity. Now I want to tell you about the capillary blood, that how we can collect the capillary blood. So it is very simple. You can take a finger and you can take earlobe as well, and there is some ankle, you can take blood from ankle as well, okay. uh, so what is the process? First of all, take a finger, there is a ring finger, which is, we mostly take blood from the ring finger, okay, and clean the area, tip of the finger. Then take your punching needle and then make a firm, softly make a puncture on the finger and then squeeze some blood out, so that the, if there is some extra amount and extra bad thing, like there are some lymph, okay, so it will squeeze out. Then take the blood at the slide, and this is mainly for, you can, by the capillary blood you can do some ABO grouping is there, okay, and like making the serum smear, okay. So mainly we take the capillary blood for these functions, okay. After that there are some tests from, for which you can do, like there is hemoglobin estimation, red blood cell count, leukocyte count, platelet count by the smear, okay. So we mainly take blood from this. Now after collection of blood you can do, you can take a cotton ball and you can put a firm pressure on it, and then it's done. It is very easy to take the blood from capillary blood, but we can't take much amount of blood or much amount of sample from the capillary blood. That's why we prefer to take the venous blood, okay, because by capillary blood you can do tests which are selective tests are there, okay. That's why, okay. So this is all about the collection of blood, that how we can collect the blood from vein and how we can collect the blood from capillary. Thank you so much.